Hello everyone. In this video we are going to study about a homeopathic medicine called Kalium bichromicum, short form Kali-Bi. Objectives: at the end of the session we will be able to describe the drug picture of Kali bichromicum, the mental symptoms of Kali bichromium, the characteristic of Kali bichromicum, and the particular symptoms of Kali bichromicum. Introduction: the common name is potassium bichromate, the chemical formula K2Cr2O7, the source Mineral Kingdom, prover Dr. Drysdale. The miasm of Kali bichromium is syphilitic, temperament, nervous and irritable, thermals chilly patient. The common name potassium bichromate, source Mineral Kingdom. Thermally the patient will be chilly, temperament nervous and irritable. The constitution: Kali-Bi patients are fat. Children will be fat and chubby. You can look at the picture here. The children will be fat and chubby. People are sluggish people, light haired and short necked. You can see the hair color. They are light haired people and the neck is really short in them. The constitution: fat chubby children, sluggish people, that is very lazy, and light haired short neck people. Sphere of action: Kali bichromium acts upon the mucous membrane. Acting upon the mucous membrane, it will produce tough, stringy, ropey discharge. This is very important. Tough, stringy, ropey. This is what you have to remember. In almost all the systems on the mucous membrane of all systems, it is going to produce tough, stringy, ropey discharges. We'll be learning in detail in the next slides. It produces discharge which is tough, stringy and ropey. Erosion and ulceration of membrane. So, Kali bichromium, it causes the erosion and ulceration on the mucous membrane. It produces ulcers and it will corrode the surface. Sometimes it produces false membrane in respiratory passages. Like in diphtheria and all, a false membrane, a pseudo membrane will be formed. After it whatever the wound is, after it heals, it forms a membrane on it, right? After healing, in the same way it acts on the mucous membrane and sometimes it is going to produce the false membrane, especially in the respiratory passages. On the skin, it is going to produce papules and pustules. On the fibrous tissue, there will be irritating and tearing pain. On the muscles, guys, there is irritating and tearing pain in the fibrous tissues. In the skin, papules and pustules. The sphere of action on the bones, that is, it will act on the periosteum, kidneys, glands. In all these places, it is going to produce congestion and inflammation. See, in the kidneys, congestion and inflammation, the glands are also being congested and they are inflamed. The bones as well. The periosteum of the bone. Congestion and inflammation. Ailments from alcohol, beer, hot water, autumn and spring. So what are all the ailments from? Alcohol, beer. Then you come to the weathers: hot weather, autumn and spring. 3 weathers and 2 beverages, alcohol and beer. Now let us go in detail about the mental symptoms of Kali bichromium. The mentals: anthrophobia. The patient is low spirited. There is anxiety arising from the chest. The person is having a weak memory. The person is ill-humored and indifferent. There is aversion to exertion. The patient doesn't like to do any sort of work. She has aversion to work. She's all sad, gloomy, low-spirited, weak memory, anthrophobia, anxiety which is arising from her chest. She's ill-humored and indifferent. Hope the mentals are clear. Now we'll go to the guiding symptoms of Kalibai. There are 3 S: shiftness, spottiness, stringiness. Guys, the pains are going to shift from one place to another. So, shiftiness, the pains are going to shift from one place to another place. Then comes spottiness, the pain in small spots that can be covered with the tip of the finger. Guys, in the Kalibai, the pains will be in the form of a small spots, like on the breast or in the stomach, wherever it is hurting, it will be in the form of a small spot. You can point the spot with the tip of your finger. You can just place your finger on the spot and say it is here where it is paining. The pain is in small spots that can be covered with the tip of the finger. Spottiness, that is why the name spottiness. You can spot the pain with the tip of the finger. Stringiness, all the discharges are tough, ropey and stringy, which adheres to parts. Guys, I already told you in the beginning, all the discharges, 3 things: tough, ropey, stringy, all the discharges. Hope it is clear. The 3 S of Kalibai, you have to write. There is shiftiness, that is all the pains are going to shift. Spottiness, you can spot the pain. There is stringiness, tough, ropey and stringy. The pains appear suddenly and disappear suddenly. The pain will come suddenly and they disappear suddenly. Now we read on the mucous membrane, they are going to produce ulcers. The ulcers are going to be punched out and perforating. Perforating is they are going to form a sort of a hole that deep. They are excoriating and then they are going to form a hole in the stomach. They are perforating, they are punched out. Edema, bladder-like appearance of uvula. Guys, in the throat, in the mouth, there is uvula, the small tongue. Hope you guys know uvula. The uvula is going to become so swollen that it is going to appear like a bladder. Allergy to beer produces diarrhea and vomiting. So the person takes beer, he is going to have diarrhea and vomiting. There is periodicity. What is periodicity? The same symptoms reappearing at the same hour, or the time is same, or the symptoms are same. The time or the appearance of symptoms are same. Headache in the morning at the same hour. So guys, headache in the morning, same hour. The timing is same. In the morning at the same hour. Neuralgia every day at same hour, 3 to 4 a.m. So the periodicity of 2 things, that is the headache. Headache is coming in the morning. It is every day in the same hour the person is having headache. Neuralgia again in the same hour, that is 3 to 4 a.m. It is specified here morning, which time the neuralgia is coming, at 3 to 4 a.m. Hope it is clear. The alternate symptoms are found in Kalibai. The rheumatism is going to alternate with the dysentery. The rheumatism is going to alternate with gastric symptoms. The headache is going to alternate with blindness. So guys, the gastric symptoms are going to alternate with rheumatism. You see, both are gastric symptoms here. The dysentery is also a gastric symptom. The gastric symptom both are going to alternate with the rheumatism. For both you have to write rheumatism. They are going to alternate with the rheumatism, whereas the headache is going to alternate with the blindness. Now you see a sort of diagonal pain in Kalibai, the right axilla and the left thigh. So you need to imagine in your own body the parts, the right axilla and the left thigh. Then from the axilla you go down to the right forearm and the left elbow, right big toe and left little finger. Guys, only you need to remember that there is going to be a diagonal pain. They are not going to ask you in detail about the specifications of the diagonal pains. You can remember the right axilla and the left thigh for now. The particulars of Kalibai. First we'll go from headache. The causation of the headache will be suppressed catarrh. Catarrh is the inflammation of the mucous membrane which is going to produce, that is known as catarrh, inflammation of the mucous membrane of the nose, or the whatever the mucous membranes, that is catarrh. Before headache, there is blurred vision or blindness. See guys, this person, the girl or the woman is suffering with headache. Before the headache is arising, there is blurred vision and blindness. We read in the alternating symptoms in Kalibai, the headache is going to alternate with the blindness. So headache, there is blurred vision or blindness. The character of the headache, 3S, shiftiness. Again here, repeating, shifting pain from one place to another. The pain comes suddenly and goes suddenly. Pain in small spot. Beautifully, 3S, shiftiness, small spotting. Again here same, it comes and goes suddenly. The modalities, it is aggravated from light and noise. It is ameliorated by lying down. So the light, if she goes on, like she switches on the light, the headache is going to increase. If somebody make noise, she cannot tolerate that, her headache is going to increase by the light and the noise. If she lies down in her room quietly without any noise and the light switched off, the pain is better. Now we'll go into the gastrointestinal tract. The mouth, sticky, dryness of the mouth and the lips, aggravation from drinking cold water. So guys, there is amelioration by drinking cold water. You can see here, since the mouth is sticky and dry, the mouth and the lips are dry. You can see the tongue, it is all cracked here, so dry mouth and lips. It is ameliorated by drinking cold water. The discharges from the mouth, that is the saliva, is going to be thick, ropey and stringy. Now you come to the tongue. It is mapped dry, red shining, thick coated, takes the imprints of the teeth. So guys, in the tongue is also going to be dry. It is going to be dry to such an extent that it is going to take the imprints of the teeth. It is thick coated, red shining. Then you come to the ulcers of Kalibai. See guys, it is acting on the mucous membrane. Acting on the mucous membrane, everywhere it is producing dryness and the discharge is thick, ropey, stringy. Again here, the tongue dry, the saliva is going to be thick, ropey and stringy. Acting on the mucous membrane on the lips, it is going to, in the mouth, it is going to produce aphthous ulcers. They are going to corrode deeply. You can see the ulcer, it is corroding deeply. Stomach, gastric complaints, mainly the peptic ulcers are seen. So in the stomach, again acting on the mucous membrane, it is going to produce peptic ulcers. It could be the duodenal ulcers or gastric ulcers. Desires beer and acid drinks. You can see the person wants beer and acid drinks. Very peculiar. Aversion to meat. In the stomach, peptic ulcers, desires beer, aversion to meat is what you need to remember. Next, we move on to the sensation of the stomach from the ulcers. Swelling of the stomach with fullness and pressure, cannot bear tight clothes. So, the Kalibai patient cannot bear any tight clothing around her waist. There is swelling of the stomach. With the fullness and pressure. She feels the stomach is full. There is fullness and pressure in the stomach. The modalities, aggravation after eating. The character of ulcer, now we are going to see in the stomach, the ulcers, how are they going to be. They are punched out ulcers, the pain in small spots, the pain shifts rapidly from one place to another, the pain appear and disappear suddenly. Next, the pain is going to alternate with the pain is going to alternate with rheumatism. We read in the alternating symptoms, the gastric complaints, may it be dysentery or the ulcers or the colic, whatever, they are going to alternate with the rheumatism. Vomiting, ropey, stringy, the gastric complaints alternate with rheumatism. Now we come to the vomiting. It is ropey, stringy, bright yellow water. They vomit the undigested food. The vomit is more than what he drinks. So guys, here the person is vomiting copious large amount of vomit, but the intake of the water is not as much as what is vomiting it out. So the vomiting, again, ropey, stringy, bright yellow color. All the discharges are ropey, stringy, and here the vomit is bright yellow color. The undigested food is also going to come out. Now let us see the stool of Kali Bai. The character: dysentery with jelly-like mucus, brown, ropey, stringy. See guys, in the vomiting you are writing yellow, ropey, stringy. In the stool you are supposed to write brown, ropey, stringy. The character of the stool is going to be jelly-like mucus. Dysentery is going to alternate with rheumatism. All complaints, gastric complaints, dysentery also alternating with rheumatism. There is periodical dysentery every year in summer. So guys, I told you there is periodicity of the time. There was periodicity here in dysentery every year in summer. The periodical constipation every 3 months. Modalities: it is aggravated in the morning and from beer. So guys, we had already seen the periodicities for the neuralgia and everything. 3 a.m. here 3 to 4 a.m. Here it is dysentery is yearly. Dysentery yearly in summer. The constipation every 3 months. Every 3 months the person is having constipation, and the dysentery is what? The blood along with the diarrhea. Dysentery every year in summer. Now let us see what it does on the respiratory system. The pressive pain in the root of the nose, the discharge of plaques. So guys, you can see the Kali Bai is going to produce a pressive pain in the root of the nose. The plaques of the mucus which are coming out from the nose, the mucus will be in the form of a plug. It will again be ropey, stringy, and the throat, there will be tonsillitis. It is extending downwards to larynx and trachea. See guys, here the throat, most probably the uvula symptom you have to write. There is swollen edematous bladder-like appearance of uvula. In the rustox, it is edematous with redness. In the rustox, the redness will be more prominent, whereas here the redness in Kali Bai, the redness will be a little less compared to, it will be little red compared to the rustox. This is how you are going to differentiate the edematous appearance between the rustox and Kali Bai. Both will be edematous, looking like a bladder, but the redness will be more in rustox. The sinusitis, the septum is ulcerated with a fetid smell, inability to breathe through nose. So guys, the septum of the nose here, it is been ulcerated. So inside the septum of the nose, the ulcers are formed which are blocking, and the person cannot breathe through it. Then the person cannot breathe through the nose. There is violent sneezing. It is aggravated in the morning. Inflammation of the frontal sinus. You can see here the frontal sinus. These frontal sinus are going to be inflamed in Kali Bai. There is loss of smell. The character of discharge, again tough, ropey, stringy. The violent pain from occiput to forehead. In the reverse back, from back it is coming to the front. From the occiput to the forehead is the pain. So guys, in the sinusitis, what you need to remember, the septum, it is ulcerated, it is stopping the nose from breathing, the inflammation of the frontal sinus. Along with that, you have to remember that the pain is from the occiput to the forehead. Asthma. Kali Bai is a marked remedy for asthmatic conditions. Asthma attacks occur at 3 to 4 am. We also saw neuralgia at 3 to 4 am. Same way, asthmatic attacks are also occurring at 3 to 4 am. They are compelling them to sit up to breathe. So, the person is forced to get up and sit and then breathe. Lying down is going to aggravate her symptoms. She cannot breathe by lying down. It is forcing her to sit up. Better by bending forward. After sitting up, if she bends forward, it is more better. She feels much better if she bends forward. So asthma occurring at 3 to 4 a.m. The patient has to sit up and bend forward. This is what you have to remember. Now let us look at the cough of Kalibai. The character is violent rattling cough with gagging and vomiting. Now we are looking into the respiratory symptoms. Coming on to the cough, there is violent rattling cough. There is gagging and vomiting. The person along with the cough is going to gag out and then vomit. The cough with expectoration of a tough, ropey, stringy discharge. Again guys, tough, ropey, stringy discharge. The sputum is also going to be tough, ropey, stringy. The vomit is going to be yellow, ropey, stringy. The stools are going to be brown, ropey, stringy. The modalities, they are aggravated during undressing and sitting. So guys, if the patient is undressing and sitting, it is aggravating. But if the patient lies down, it is ameliorating. So it is different from asthma. Asthmatic attacks are making her to sit up, which is like ameliorating the complaint. Whereas the cough, if the patient's sitting, it is going to aggravate the complaint. Now let us go to the concomitants of cough. There is pain in the chest. You can see the person is holding his chest during coughing. The pain in the chest. The pain in the chest is in the form of small spots. It appears and disappears suddenly. It shifts rapidly from one place to another. The same three yes are repeating here. Spots, appearing shiftingness, and appearing and disappearing suddenly. Then we come to the abdomen. There is a colic alternating with cutting pain at umbilicus. You can see the umbilical region here. There is cutting pain at the umbilicus. The bloating of abdomen followed by eructations. The burps are nothing but the eructations. There is first bloating of the abdomen, then the person starts with eructations. She or he starts burping. There is soreness in the right hypochondriac region. See, there is cutting pain in the umbilicus. Then you go to the right hypochondriac region where the liver, gallbladder, everything is there. There is soreness in the right hypochondrium. Chronic intestinal ulceration. You can look at the intestines here. There is chronic, from years long the person is having intestinal ulcers. Now let us see the kidneys. As we read earlier, it is going to produce congestion of kidney, the ropey mucus in urine, nephritis with a scanty albuminous urine. The urine is going to be scanty and albuminous content, albumins will be found, the proteins albumins are going to be found in the urine. Along with it, there is inflammation of nephrons of the kidney, nephritis with the scanty albuminous urine. There is continuous desire to urinate. After urinating, a drop seems to remain which cannot be expelled out. So the patient is not satisfied after urinating. She feels that a drop is still remaining in the bladder, or it is not being expelled out. On the male, in the males, there is itching and pain of the penis with the pustules. It is aggravated at the night. The itching and the pain of the penis, it is aggravating at night. There will be pustules on the penis. Constriction at the root of the penis. The discharge again here are stringy, jelly-like and profuse. Hope it is clear. Now we move on to the female symptoms of Kalibai. Menstruation is too early with giddiness. The concomitants are going to be giddiness, nausea and headache. Menstruation are occurring too early. The pubertal age, too early her menstruations are occurring. And the concomitants are going to be giddiness, headache, nausea. Menses with the suppression of urine. Leukorrhea. The leukorrhea is going to be acrid yellow, ropey with the pain across sacrum, and heaviness in the hypogastrium. We already read there is going to be heaviness in the hypogastrium, and the leukorrhea is ropey again, acrid and yellow. Heart symptoms: dilated with the kidney lesions, cold feeling around the heart, pricking pain in the region of the heart. The pulsations are felt in all the arteries. So guys, the heart peculiarities here, again there is pricking pain. The spottiness are not found in the heart, I guess it's not given. The pulsations are going to be felt in all the arteries. There is going to be a cold feeling around the heart here, and around the heart the person feels it is really cold. Rheumatism, syphilitic rheumatism, sensation, tearing sensation in tibia, swelling and stiffness of joints. So guys, Kali Bai, you go to the extremities, the rheumatism, down in the tibia there is going to be a tearing sensation, swelling and stiffness of joints. In the rheumatism, it is a common symptom. There is swelling, there is stiffness of the joints. You can see all the joints here. There is stiffness, there is pain and swelling. The modalities, it is aggravated by cold and motion. It is ameliorated in a warm room. And you can also add in here, the gastric symptoms will alternate with the rheumatism. Now let us look here, they've given the concomitants. Rheumatism is going to alternate with the gastric complaints. The character of the pain, they are wandering pains. The pain fly rapidly from one place to another, shifting. Pain appear and disappear suddenly. The pain is in the form of small spots. Even the rheumatism, you can exactly pinpoint in the joint where exactly it is hurting. The pain is in the form of small spots. So here the rheumatism is going to alternate with diarrhea, the gastric complaints, dysentery. Extremities, sciatica of the left side, aggravated by standing and sitting and lying on the bed. Amelioration by motion and flexing the legs. The wandering pains along the bones, it is aggravated by cold, the cold sweat on the hands and the feet. So guys, the sciatica, it is going to be aggravated by standing, and it is going to be ameliorated by motion. If the patient stands for a long time, it is going to aggravate the pain of the sciatica, and then if she moves, it is going to ameliorate the pain. Along with that, there is cold sweat on the hands and the feet. The skin of Kali bichoricum, there are punched out edges of the skin, papular and pustular eruptions and itching. So there are pustules, papules, and along with that there is going to be itching. Again the discharge is ropey, stringy in Kali bichromium. The general modalities, we read a lot of modalities. In general, the modalities aggravation is from hot weather, beer, morning, 3 to 4 a.m., coitus, undressing. Amelioration is by lying down, open air, cold weather. The cold weather amelioration, only the skin symptoms are going to ameliorate in the cold weather. Clinical, Kali Bai is indicated in asthma, bronchitis, bone affection, cough, constipation, fever, headache, lung affection, nasal polyp, neuralgia, nose affection, peptic ulcer, rheumatism, skin complaints, sciatica, ulcers, vomiting, whooping cough. Thank you. Hope Kali Bai is clear for you guys. If you like my video, hit the like button and subscribe.